Of the 12th Annual Leadership Summit on Health Disparities and Congressional Black Caucus Spring Health Braintrust. I'm happy to be here along with my friend Dr. Gary Puckrein of the National Minority Equality Forum. We had a great first day of our summit, full of robust and engaging dialogue on how to address minority health disparities, and we've got a great lineup of sessions for you today. We're also very honored to have with us this morning U.S. Surgeon General Vice Admiral Murthy. Thank you for joining us. We really appreciate it. And we want to thank all of you again for joining us. One of my primary goals with the CBC Health Braintrust is to expand our outreach to healthcare stakeholders and the general public. I want to remind you again to please engage with us. We want to get to know you, learn from you, and discuss how we work together to reduce health disparities. I hope you find the day very interesting and informative, and that you leave here renewed in our shared mission of improving health outcomes for all. I also want to remind you that we do have a stress room. Don't run out all at once, but there's someone there waiting to give you chair massages. There's good things to drink, non-alcoholic, and you can just relax in that environment. So it's behind the registration desk. We thought that was important too. So now it's my honor to introduce Dr. Gary Puckrein, President and CEO of the National Minority Equality Forum.
Thank you. Good morning. So I promised to be very brief this morning because I think you've heard enough of me from yesterday. I want to thank Congresswoman Kelly and her staff. They've been doing just amazing work, and so it's been a great honor. I also want to bring greetings to the Surgeon General and appreciate him taking his time. I think you got an exciting program in front of you today. I think what we want to try to do as we move through the day is really begin to think about, so what are the action items that we can tick off? Because what we want to make sure when we leave here that we haven't been a talking head convention, that we're actually taking some steps forward to see that we do something about these health disparities. So again, have a great day. I look forward to talking with you.
Thank you. Vice Admiral Vivek H. Murthy, MD, MBA, was confirmed on December 15, 2014 as the 19th United States Surgeon General. As America's doctor, Dr. Murthy is responsible for communicating the best available scientific information to the public regarding ways to improve personal health and the health of the nation. He also oversees the operations of the U.S. Public Health Service Commission Corps, comprised of approximately 6,700 uniformed health officers who serve in locations around the world to promote, protect, and advance the health and safety of our nation. Dr. Murthy has devoted himself to improving public health through the lens of service, clinical care, research, education, and entrepreneurship. The son of immigrants from India, Dr. Murthy discovered a love for the art of healing early in his childhood while spending time in his father's medical clinic in Miami, Florida. After attending Miami Palmetto Senior High School, he received his bachelor's degree from Harvard and his MD and MBA degrees from Yale. He completed his residency training at Brigham and Women's Hospital and Harvard Medical School, where he later joined the faculty as an internal medicine physician and instructor. As a clinician educator, Dr. Murthy has cared for thousands of patients and trained hundreds of residents and medical students. He regards caring for patients as the greatest privilege of his life. Seen by many as a proven leader who can use 21st century approaches and technology to modernize the role of Surgeon General, Dr. Murthy will focus his efforts on building cross-sector partnerships and communities to address the epidemic of obesity and tobacco-related disease, to reduce the stigma associated with mental illness, to improve vaccination rates, and to make prevention and health promotion the backbone of our communities. Dr. Murthy firmly believes that our nation's greatest strength has always come from its people. Improving the health of our people means strengthening our communities and our country. That will be Dr. Murthy's highest priority as Surgeon General. And without further ado, I'd like to introduce Dr. Murthy, our U.S. Surgeon General.
Thank you, Congresswoman, Dr. Puckrein, and all of you who are here today for that warm welcome and for your kind remarks. It's especially good to be here, although I will say that I recognize that for all of you to get up early on a weekday is not always easy, so thanks for showing up, I should say. And I do want to say that, while there are a lot of issues that are going to be discussed here today, as I looked at your agenda, I just want to emphasize to you just how important it is to me and to all of us on the outside who may not be participating in this conference, that you are talking about the issues that you will be discussing during this conference, particularly health disparities, an issue that's of particular importance to me. As Congresswoman mentioned, my family originally is from India. And we came to the United States for the same reason that so many immigrants come to this country, because my parents were searching for better opportunities, for better education for my sister and I. They were also looking, though, for a country that had the kind of values that they had always hoped to have, in their homeland, values that centered around people's ideas, values that that involve judging people by their experiences and by what they could do, not by what they looked like or where they were from. And as they traveled from India to England to Canada and eventually to the United States on that journey, they encountered their fair share of discrimination. My father, when he was practicing medicine in England, would often note that because of the color of his skin, he and the other immigrant doctors were often not given a chance to speak up during meetings. They were often given the weekend and night shifts instead of being given the day shifts. And it wasn't something that was done on the side, it was just done very openly, because that's just what the times were like. Discrimination was something that was tolerated, something that was part of the culture, something that we accepted. But they kept their eyes on the United States and their hopes alive to come here one day, because they hoped that when they eventually made it to this country, they hoped that they wouldn't encounter that. And more importantly, they hoped that their kids would be able to grow up and not have to encounter that kind of discrimination either. So that's what brought us to Miami. And while our country is not perfect, and all of you know that, while we have had our share of challenges in the past, and we still bear the burden of those challenges now, and probably will to some extent in the future, we know that we do provide greater opportunities, and we do provide greater platform for growth than almost any other country in the world. And I stand here before you as somebody who has benefited greatly from our country's generosity and from the support that teachers, that mentors, that well-wishers throughout my life have given me. To that, I really credit the United States, and I'm grateful that my parents made that decision ultimately to come here. My inspiration to go into medicine, to think about public health as an issue, came from those early years in Miami, where I spent many hours and weekends in my father's office, where my dad saw patients and my mother managed the office and ran it. And the truth is, she wasn't a doctor per se, but she was every bit as important in the healing process that patients went through, because she built relationships with them just like my father did. She talked to them both before and after their appointments. She made it a point, as my father did, to understand not just what their illnesses were, but also who they were as people, where they were from. And that included going out to visit them where they were. This is what my parents did, and that's what inspired me to go into medicine in the first place. I saw it not just as a place where you could diagnose what was potentially wrong with somebody and connect them with the treatment, but I saw it as a place where you could build a relationship, because that's what my parents had done. Now, over the years, after making that decision to go into medicine, I had the great opportunity to care for many patients over the years. And I will say, it feels funny sometimes to say that I've had a chance to care for them, because I know when I look back on it that they have also cared for me in many ways that they don't actually even realize. Because it's those conversations that I've had with patients, the opportunity to witness their journeys as they've gone from a place of often often great difficulty and illness to often a place of, if not cure, at least comfort. And I've learned from those journeys that they have shared with me over the years. And so I regard caring for patients really as the great privilege of my life. But it has also taught me that there is more work that we have to do when it comes to building not only a better healthcare system, but building a country that can better support health in our communities, big and small. For example, my patients have taught me that as much information as we have on the internet in 2015, that there's still a great deal of misinformation out there that needs to be addressed. And I saw this firsthand when at the very beginning of my tenure as Surgeon General, there was a measles outbreak in California, and I encountered all kinds of myths and misinformation about measles that we then spent the next few months traveling around the road to address in person, through media, through funny videos with Elmo, which we just released a few days ago. But these are the kind of things that we need to do to combat misinformation that's out there, because the challenge we have now is that there's so much information out there that people don't know what's right and what's wrong and who to trust. The second thing my patients taught me, though, was that in addition to misinformation contributing to poor health, we also have great challenges when it comes to poverty. And all of us know, and all of you know because you've been working in this space for a long time, that we cannot ignore the link between poverty and poor health. And in a country as resourced as ours, as within a country as principled as ours, it strikes me as unacceptable that we would allow somebody's health to be tied to their income or their socioeconomic status. My patients also taught me that one of the great challenges that we have to overcome, every one of us, not just as institutions but as individuals, is entrenched beliefs. Beliefs that tell us that our habits are too hard to change, that tell us that there are too many forces amassed out there that have a vested interest in keeping things the way they are, whether those forces are selling junk food to our kids or telling us that we should adopt other facets of an unhealthy lifestyle. But when I look back on our history as a country, we have proven that we can change entrenched beliefs. There was a time, for example, when doctors like myself used to smoke, and in fact used to advise their patients to smoke. There was a time when so many people smoked in this country that we assumed that that was just part of who we were, and that to ban smoking in public places, to tell people that they couldn't smoke on an airplane, would just be unfathomable. But now in 2015, we look and we see that we have been able to achieve an unprecedented expansion in smoke-free places. We've been able to drop our smoking rate in this country from 42%, where it was in 1964, to 18% just a few years ago. That's progress. Seatbelts is another area where years ago, many people didn't wear seatbelts. And the idea that you could somehow compel people to do so, again, seemed against the grain. It seemed nearly impossible. But now, in 2015, wearing seatbelts is not only part of our law, but it's part of our culture. It's something that we often do automatically, not 100% of the time, which is why we still have work to do, but a big difference from where we were 10, 15, 20 years ago. So that shows me that entrenched beliefs can change. But the last and most important thing that my patients have taught me is that we have to make a shift from a society that is almost entirely about treatment now to a society that is equally about prevention. All of us know that it's better to prevent illness than to deal with illness later on and to try to cure it. That wisdom has been carried in aphorisms and in adages that have been passed from grandparents to kids to grandchildren over generations and generations. So why isn't that reflected in how we actually build our country? Why isn't that reflected in our healthcare system? Well, that's a challenge that we face now, but it's a challenge that we must take on. And it's especially important that we take that on for the purposes of, with an eye, rather, toward health equity. Because as much as it is important that we improve our healthcare system, as important as it is that we make prevention a priority, we have to do both of these things in ways that ensure that the benefits of both treatment and prevention are accruing to everybody in our society and not just to a privileged few. And that's what I saw also during my years practicing in the hospital, which is that the people who would come in time and time again, the folks who had the greatest burden of illness, were often the poor, those who were from minority communities, and those who were from our LGBT communities. These are the folks who experienced the disparities in health, the disparities in care that all of us are well aware of and that we're committed to. Now, I'm happy to say that since the Heckler Report 30 years ago, we have made a lot of progress in reducing disparities. And many of the stats that go along with this progress are known to you. But when we look at the African American community, we see that we've been able over the last 30 years to cut mortality from heart disease in half. We see that life expectancy gaps between blacks and whites are more narrow now than at any level since 1985. We see that minority children are receiving vaccines to protect against disease. And between 1995 and 2011, during that time span, we have been able to nearly eliminate the disparities in childhood vaccinations. And this is in part through the Vaccines for Children program, but also in large part because of the leadership of advocates and clinicians and community members like you. And most recently, through the Affordable Care Act, we have seen that we have been able to bring access to affordable, quality health care to millions in minority communities who did not have them before. And since 2013, in fact, we've been able to enroll 2.3 million African Americans in healthcare coverage. We've been able to also increase coverage among Hispanics by 4.2 million. And that's just in a couple of years. We have more work to do, but what we've done in these last few years gives me great hope for what we can do in the future. All of us are here, though, because we know that the need to do more exists not just in these statistics, but we see them every day in the people in our communities, people who still suffer without access to care that they need. And that's why I'm committed to making not only prevention, but health equity the focus of my approach to addressing health over these next few years. We know that if we want to improve health for everyone, if we want to build a prevention-based society, that we have to do this not just by building more hospitals and more clinics. We have to do it not only by training more doctors and nurses, but we have to do it by engaging all sectors of our community. That means looking to our faith-based groups, looking to our employers, looking to our schools as well as our civic organizations for their leadership and their engagement on health. Many times when I travel around the country and I meet with folks from non-traditional health sectors, they say, I'm not really trained in health. Well, what can I really do to improve health in my community? What's key is they often understand that it's important. I meet many CEOs and leaders of companies who realize that the health of their community is essential for them to have a healthy and strong workforce and to lower their healthcare costs. I meet with leaders in churches and temples, in mosques and in synagogues who tell me that they are troubled by the health difficulties that their congregants are facing, but they are not sure where to get started in terms of addressing those. I talk to folks in schools, teachers in fact, who tell me that their kids are smoking e-cigarettes in the classroom because they don't have a policy around it, because there's not enough science to know what to do. I talk to teachers who tell me that their kids are increasingly overweight and that they have kids who have diabetes, which they never even saw 15 or 20 years ago in middle school or high school. And they're not quite sure what they can do as teachers to address this problem. And that's why part of my goal, one of my main areas of focus as Surgeon General, is going to be to reach out to these different sectors to help them see the role that they can play in improving health, but also understand that it's essential, that we can't actually get to the kind of society that we need, a prevention and health equity-based society, without having the engagement of these different sectors. When over the next few years, what I plan to do is to work specifically with faith leaders to address the stigma that is still associated with mental illness, a stigma that prevents so many people from coming forward to get the help that they need. I plan to work directly with our leaders in the entertainment industry and with our leaders in the sports industry as well to ensure that we are creating and putting forth positive role models for our kids, role models who can guide our children and inspire them to live healthy lives and make healthy choices, because that's a responsibility that we have. In the 2014 Surgeon General's report on tobacco that we released, we calculated that if we were able to eliminate smoking in movies that kids see, in movies that are PG-13, PG, or G, that we could save 1 million children who are alive today from premature tobacco-related deaths. That's an extraordinary number, and that's within our grasp. We actually know how to do that, and we need the partnership of our movie producers and our entertainment industry at large to do this. That's a partnership that I will build over these next few years. And I will also work with employers to build partnerships that will bring physical activity back into our work culture. We have a culture of sitting and working at most of our offices. Why don't we have a culture of walking and working? I've been converting more of my meetings over time, over the last few years, into walking meetings so that we can not only go to the gym a few times a week, which is what all of us should do, but we can actually make activity part of our day-to-day life, which not only makes it easier to stay in better physical health, but which also improves our emotional well-being and improves our mental function. These are some of the partnerships that I will build over the next few years. These are some of the priorities that I will act on. But I tell you clearly and emphatically that I can't do this work alone, that I need your help, that I need the partnership of individuals across this country. Because while in the office of the Surgeon General, many people have looked at our office and they think of a model of one individual going out there and sharing truths about science. That's a model that may have worked decades ago, but it's not the model that we need in 2015. We need to not only speak the truth, but we need to mobilize others to do the same so that we can expand the impact of our messages and so that we can quickly change some of our beliefs as well as some of our cultural practices that lead us down paths of poor health. I'll tell you in closing why I feel hopeful about this task. Because when I talk to many people about the work that we have ahead of us, they often feel weighed down by the enormity of the challenge. They look at industries which have billions and billions of dollars who they think may not want to be partners with us, and they wonder how we're going to get them on board. They look at how difficult it has been to get people to change their choices about food or around activity, and they ask us, how are we really going to change people's minds and change their behavior? But what gives me hope are the people that I meet along the way. People in communities across this country who have taken on these challenges and who are actually generating results. People like the parents and organizers in Roanoke, Virginia, who have taken it upon themselves to teach kids in schools about what healthy fruits and vegetables actually are. And they are, in a measurable way, changing the preferences that children have about their favorite foods. Now, I draw hope from the mayor I met in Orlando, who has built a collaboration with behavioral health centers across the city so that they can identify mental illness in their incarcerated populations early and get people the help that they need instead of criminalizing mental illness, as unfortunately is so often done. This is what gives me hope. And I also draw hope from the black pastor that I met in Birmingham, Alabama, on the very first stop in my listening tour, who told me that he had made a decision with the other leaders in their church to substitute fried chicken with baked chicken on Sundays. And he told me, he said, you know, as a son of the South, this was a tough decision to make. But he said that it's been better for the people in their church. People have accepted it now. And he even told me, you know what? I kind of like baked chicken now, after all. But perhaps the person who sticks in my mind most when I think about these last few months is the woman I met on the way to Birmingham, on the small 19 or 20-seater plane that took us from D.C. to Alabama. And as I walked out off the plane, I turned and I saw her, and I stopped to talk to her. She was a woman who many of you know. She's 103 years old. She was a woman who helped convince Dr. King that Selma, the March on Selma, was the right campaign to build, the right path of action to take in our civil rights struggle. And when I sat down and talked with her, and I thanked her for training a generation of activists who not only made a difference during the civil rights movement, but whose inspiration and whose example has had ripple effects throughout this country, has helped build and support and inspire movements that have changed not only civil rights, but rights for so many other communities. And I thanked her for all that she has done, for all the people that she inspired and trained. And she looked at me for a moment, and she said to me, you know what? She's like, I've done those things, but I'm not done yet. And I thought to myself, at 103 years old, she's not done yet. And it reminds me that all of us aren't done yet either, that we have a great deal to do. And over these next coming months and years, I'm looking forward to getting into that doing with all of you. I'm looking forward to partnering with you, to learning from you about how we can build more collaborations with our churches, with our temples, with our employers, and with our other institutions in our communities, which have so much potential to change culture and to change health, but which don't know it yet. They need you to tell them. They need you to show them how to do that. We have enough examples in this country of how it's being done that we don't have to doubt that it's possible. We merely need to bring people together to see those examples and to believe that they can do the same. So I thank you so much for the work that you are doing, because it is essential to that shared mission we have of building a healthier and a stronger America. And I will tell you that while the work that we have to do may not be done in the next few years that I have in office, I know that that work will continue for years afterwards, but I also know that we can make a great deal of progress in the next few years. And I certainly hope that we will work together to not only make that progress, but to make real health, to make better health, to make a meaningful and healthy life accessible to more kids and adults throughout our country. Thank you so much.
Thank you so much, Surgeon General, for your thought-provoking message. And also, I met the 103-year-old woman that you're speaking about. Lorraine Toussaint played her in Selma. And when she met the president, he whispered to her and said, because of you, I'm the president, and I can go out and make this State of the Union address. And she said to him, well, you better do a good job. So she's still very, very feisty. If you would come back up. We would like to present you with the Charles Richard Drew Award.
Paparazzi.